So have you ever had an injury that you couldn't recover from, or a minor surgery, and thought, will the TRT that I'm on help me? We're going to find out after this, so keep watching. Hi, welcome to Balance My Hormones, where we help men and women on their journey to optimal hormone balance. If you're new to the channel, please press like and subscribe so you get future content. So we're here with Dr. George Tiliatos, an expert in TRT, and has written numerous books on bodybuilding, HRT, hormone replacement. And the topic we're talking about today is how to recover from injuries or surgery. Dr. George has had a recent surgery. He's going to discuss his experience and why he feels, also based on the science, why his improvement and his recovery have been helped along by TRT and HRT. Hi George, how are you today?
Hi Michael, thanks for the invitation once more time.
No, thanks, we always enjoy doing this. So how are you feeling now? Are you feeling better?
I feel great actually. It's almost 5 days post-surgery. I was operated on Friday morning, and actually it's 12 days post-trauma. So the accident occurred on Friday night, okay, and I wasn't able to train legs for 10 days. I did it yesterday with my body weight, of course. I was squatting and I was lunging with my body weight of 218 pounds, 98 kilograms, 99. And I did, of course, a full workout with the rest of the body groups, but just pumping, getting jacked with more reps and few weights. And I have to tell you that I feel fantastic. I use minimal amounts of painkillers and anti-inflammatory drugs. I visited today my surgeon, who told me, what kind of drugs are you using? And I told him I just use a little bit of non-steroidal inflammatory. I minimize my cutting, but I sent him a text, about this regimen that I'm following. Of course, he's not aware of this. That my HRT regimen helped a lot in order for my rehabilitation process, and recovery and recuperation. So testosterone, of course, but also my HRT that's composed of nandrolone and growth hormone plus HCG, DHEA, DHT.
Before you go for the whole thing, George, let's back up and tell everyone what happened, how it happened.
Yeah, I was doing heavy T-bar rows and barbell rows and deadlifts.
So how long ago was this? 2 weeks ago? 3 weeks ago? You were doing heavy barbell rows?
12 days.
12 days ago is when you first injured and what did you injure? It was a spinal injury.
Yeah, it was lumbar 5. So the last lumbar vertebra, into the intervertebral space between the two vertebrae. So lumbar 5 and lumbar 5 and sacral 1. So the disc was broken, and fragments of the disc were found in the hyporetic sac, which is a portion of the spinal tube. Okay, of course the spinal cord ends in a higher level, but over there in the hyporetic sac there are some nerves that obviously they were affected by these remnants, these fragments of the broken disc, and also my sciatic nerve was really injured. That's why it gave me horrifying pain towards my left limb, from the butt to the hams and then to the fibula and to the tibia,
So you couldn't walk? Did you have difficulty walking, or?
I couldn't walk. I mean, I was standing in order to pee, and I was holding on my one foot, on the other foot, and unless I couldn't stretch my other leg, flex the hip in order to stretch the sciatic nerve and unblock it, it was horrifying pain, and I felt completely, helpless and disabled, So it was horrible. The pain, Wikipedia scales it 9 out of 10 of the highest pain level, and I took massive doses of painkillers and anti-inflammatory drugs in order to sustain the pain and be able to take care of myself in the restroom, and basic stuff, I couldn't walk to my kitchen and have my breakfast. I was asking for my sister to prepare the breakfast for me. So it was terrible. And so I visited 6 doctors, actually, two of the finest neurosurgeons that told me this is something common that you shouldn't open up. It will heal progressively, and every hernia, because I was herniated and bulging discs since 2018. The point is, last week the disc broke. Okay, so this herniated disc or bulging discs will be phagocyzed by the macrophages and will be resolved as connective tissue and will heal in the long term, though. Okay, the point is, until then you're gonna suffer major pain. And another two orthopedic surgeons told me that yes, it will take some time and will heal in a few weeks. Perhaps you should step aside from exercise, of course, and manage the pain. But the professor of orthopedics, who is specified in the spinal cord injuries, told me that according to your lifestyle, and because of those fragments that are found in this specific space of the spinal cord, you're going to suffer some calcification in the long term, okay, and being also disabled in order to abduct your lower limb. So 20% I was not able to abduct my left limb, and also stand on my left. How you say calcaneus is the back of the toe of the feet. Yes, this bone that you. Okay, so I had this inability, 20%, so 4 out of 5, and this was under a neurological examination by the doctors. Okay, and he told me that actually this will make it worse in the long term. And actually, 20 years ago, my mentor in bodybuilding had the same injury. And he texted me last week. He told me, today I'm half paralyzed in this movement. So you cannot. This is a flexing the ankle joint with the calf, and the opposite direction with tibialis anterior when you raise your toe, your feet. Okay. So yes, it will be a problem in the long term. So this surgery was actually something precautiously to avoid the worst in the long term. Okay.
So it was preventative then.
Yeah, preventative. Yes, and actually, the pain and the pain would go from 9 to 0. Okay, 9 to 1. Okay. But the recuperation was so fast that I was able to walk the next day to attend my grandmother's funeral or to do some cardio at the goods, and actually go at work and do a little bit of cardio just to send some blood the days after. So if I was not operated, I would have problems with motility, and also in the long term, some paresis. We mean half paralyzed, in some degree.
Yeah, that's not really good for the future as we get older. You want to maintain your mobility. So how are things now? You said you got an excellent prognosis from the doctor, and you think it may be due to some of the TRT and the HRT that that you're on as part of your hormone replacement therapy. So what's the prognosis that the doctor had mentioned?
But it's excellent. He told me, how you feel. Are you able to go to work? I mean, how's pain? I told you that it's perfect. I mean, I feel like I'm like a car who did the service and to the suspension, and I feel great now. He kind of laughed, but I believe that testosterone, and mainly nandrolone, because nandrolone speeds up muscle recovery after injuries, but also growth hormone, because growth hormone is able for cellular metabolism. Anaplasys means healing, rejuvenation, the basis of anti-aging, making new cells, and recovery, even of peripheral nerves. And actually, there's some data online about this, some recent data. They speed up recovery and healing, of the tissues. And this is about what steroids are about, to make new tissues under, for instance, burns, okay, or wounds, big wounds, okay. And of course, to make new tissues, that is the process of anabolism in medical field.
George, do you think there's enough literature or data to present evidence to say that for many patients who have an injury that it could be prescribed in addition to that TRT, like nandrolone or HGH, for the purpose of recovery and not just necessarily for the purpose of restoration or replacement therapy?
Yes, I believe this is what replacement therapy can help about, apart from the hormonal environment for the lack of sex drive, and the metabolic issues about diabetes or metabolic syndrome or depression or osteopenia or anemia. It can majorly help with the muscle skeletal system, and the connective tissue and the joints. Okay, so healing of the ligaments, of the tendons, of the peripheral nerves. Actually, arteries become more elastic with growth hormone because collagen fibers are synthesized and make it more elastic and less atherosclerotic. So the more GHA you're using in the long term, the more elastic your arteries are. And actually, smoking cuts down vitamin C that makes more fragile the arteries, Yes, I feel, very energetic when I wake up in the morning, and I don't feel sore and in pain, And I owe this to growth hormone. Actually, I sleep 6 hours rather than 8, and I feel the same level when I was sleeping 8 hours, Of course, proper timing, 11 to 7, okay. But after six continuous months of using low dose of growth hormone, now I visualize and I realize the effects, and especially after this surgery,
Fortunately, you're one of the doctors that are more open-minded about the benefits of, growth hormone along with the TRT. And I suppose what I was asking, how do we convince the rest of them that there are therapeutic benefits after an injury?
To apply it to patients that have these issues with healing process, and rehabilitation or recovery, All they have to do is this.
That sounds like a reasonable plan. All right, is there anything else you want to discuss on this topic? Do we hit all the big points?
So we have another application to the locomotor system with testosterone and the rest of anabolic hormones. Apart from the other applications. So yes, you can recover faster, and it's not necessarily to have a spinal cord trauma or to become operated, but from any kind of physical activity, you may recover faster throughout your HRT regimen,
Okay, well, that sounds like a win-win, especially when you're, you can't walk if you've got pain, if you're getting some improvement. I guess the question is, would one stay on those additional, I suppose it's the anabolic steroid nandrolone, or would they stay with those treatments? How long would they stay with it? How would that be determined? I guess the doctor that's treating them would determine how long they stay with it. I mean, is that what's your plan? You did a short course added to your TRT?
Well, you have to watch out your labs, of course, your lipids to be well, your hematocrit, your hemoglobin, your liver enzymes, your homocysteine, that are mainly affected by nandrolone. And now about the IGF-1 to be optimized, watch out your A1C from the growth hormone, But as long as you're healthy, Michael, why on earth to stop this if it works? A small dose, okay? So I'm using 175 testosterone, I'm using 35 nandrolone per week, and I'm using 3 G8s. If I can afford it and it works for me, then why on earth should I stop this since I feel like a Superman? And mostly my labs are healthy, okay? I don't struggle. Okay, so knock on wood, who knows if I broke my leg the other day, Do you have to restart again my protocol? So I keep this because I feel vulnerable at 47. I cannot do the crazy stuff I used to do, So why not trying to reverse time, and slow down aging?
I've been on, TRT, HRT. Well, I'm on most of the hormones.
Providing T4, it will make your mood better. I start taking 25 micrograms of T4, the least dose of the basic thyroid hormone that makes also T3. And maybe I look leaner, but also I believe I feel less tired in the morning, because her talk said if you wake up tired in the morning, it's just like the adrenal fatigue syndrome, and you supplement with T4, this is resolved. Okay, so I believe that our organs are going downhill. So I'm going to watch out my TSH. As far as it's low and it's good, and I don't have heart palpitations, okay, why on earth to stop it? Because perhaps my thyroid my TSH would go 3 or 3.5, you know.
Yeah, or maybe even a desiccated thyroid or a mix of T3, T4 in some cases have shown even better efficacy.
Mid-40s, start developing some nodulations, you know.
Yeah, and we will, on another video, we'll discuss thyroid treatment and its benefits that goes along with TRT. But so that should be out in another episode. And if you have specific questions for that, please leave some comments, and we can address those in future. Well, that sounds like a reasonable plan. It's good to see that you two are also on all the hormones. And like I said, my journey's been about 25 years, starting with testosterone treatment. And I agree, I'm 46, and it has improved my quality of life.
Pharmaceutical grade stuff, because everybody will start going underground labs and dig up all the compounds, you know. So it has to be officially approved, you know.
And that's the danger sometimes with the information on the internet. I mean, we're trying to provide a balanced, no pun intended, perspective and view, within the confines of a medical clinic. But there's so many people who will read something, and I come across it all the time, and they decide to, take it into their own hands, even when they are prescribed things, to say, oh, I'm going to add a little bit of this and a little bit of that. When really they should focus on what their doctor who's treating them at that time is recommending, because otherwise why even, utilize a service if you think you're going to just kind of do it on your own.
Yeah, I told you that the day before the surgery, I had to be consulted by a cardiologist. So she asked me, what are you on now? What are you taking? I said this, that. And finally, she couldn't realize. She told me, do you need all that? I said, I'm under optimization. Of course, I watch out everything. And I believe I do need all these things. And there is something problematic with my ECG or with my echocardiogram, you know. But if somebody doesn't know, he just blames and demonizes. So I told him finally, my last word was, without testosterone, you will develop cardiovascular disease through metabolic syndrome and diabetes. That was my final word to her, okay?
And that's so true. And that's why it's so important to always stick with a healthy amount of testosterone. So thanks, George. That's very helpful, your perspective on your use of additional hormones and supplementation to help you with your recovery from your surgery. I'm really happy to hear things are going in the right direction for you. And it sounds like there's a combination of different hormones that may be used under the doctor's care, and to look at the benefits that it brings to your quality of life, which is important as we age, especially as we become more fragile as we age. And the hormones may buffer us against some of this fragility. So
we become more fragile as we age.
And having TRT and having HRT helps us buffer against some of that the frailty that you'll experience. And I'm happy that I'm on TRT and HRT. I know you are too, George. I think that's something that I'll continue to as long as my health improves, and you should make sure that your health indicators are all in balance and under the care of a doctor. So if you have thought about, or if you are using any other substances to help improve your recovery from any injuries, let us know in the comments below, and we can address them next time. And also don't forget to like this video and subscribe if you want to see more content like that. It really helps the algorithm. So thanks again, George, for coming on, and we'll see you next time.